OSCE or London Hospital OSCE. You decide. Our central London purpose-built NMC OSCE course and practice rooms include all of the equipment you need to practice for your NMC OSCE exam. You get the same expert team by your side, the same expertly prepared materials, and now a dedicated space built just for our international and return to practice nurses. And guess what? We've got an introductory special offer for when you book your NMC OSCE course at our website. Use company code LONDON to attend your 3-day Central London NMC OSCE course for an incredible $457.50. Learn more at www.oscenurses.com.
Hello, Manong George here. Welcome to our channel, and today we have a very special guest.
Hi, my name is Keeme. I live in London and I am a med rep for a spine company here in the UK. So I've been in the UK for 10 years. I'm a spine and orthopedic trained scrub nurse here in the UK. I started my job as a med rep 2 years ago. So that was 8 years into my theatre practice. And this job was offered to me by one of the med reps that I used to work with in my previous hospital. So he offered me the job and I took a chance and I've never looked back ever since. For me, being a scrub nurse is a great advantage for this job because obviously this job entails a lot of hours being involved with the surgeons and the nursing staff in theatre. So you're there to support the cases. In my case, in spines, the work is very much rep dependent. So we collaborate a lot with the nursing staff. So we go through the kits, we make sure that the sets that are needed for your procedures are available in theatre, make sure that everything's working well. And we also talk the nurses through the procedure, what's going to happen, what specific instruments they'll need, and the different details about the implants that the surgeons are going to use. In theatre, we also talk to the surgeons, ask them what their surgical plan is, what the best approach is for the patient, whether they need a specific implant or if there's any alternative. So it's something that we also discuss with the surgeons. Pros and cons. There are definitely a lot of pros. First off, it really broadens your professional network. So with this job, you get to travel to different hospitals, you get to meet different surgeons, learn about their techniques, their approaches, the different procedures that they do. You get to meet different theatre teams from different hospitals. So you get to chat with the senior nurses that lead the theatre. You get to meet theatre managers that run the department, what their concerns are in terms of training the staff, or if there's any shortfalls in the number of kits that we have on the shelf. And you also get to meet people in procurement, in purchasing, in sterile services. So it definitely is a plus that you get to meet a lot of people and you understand what their involvement is in the process of delivering these operations to patients. At the same time, you also get to meet people from different companies that also sell the same product, whether it's, say for example, in spines, there's Medtronic, there's the Pew Synthes, there's Globus, there's Nuvasive. There are many players in the field and you get to meet these people and you get to see what their approach is in terms of catering to the surgeons and also to the different departments in the hospital. So so other benefits of the job as well is that you get a company car, your transport gets paid for if you don't need to drive. So I live in London, so I don't really drive that much. So my commute is paid for by the company. It's whether, if I need to take a taxi or I need to take the tube or the train or a plane, for example, if I need to travel overseas, which doesn't really happen that often because of COVID. But your transport is practically covered by the company. Your meals are also covered, whether you start late, if you start early or finish late. So that's one benefit. You've got also medical and dental benefits from the company, so you get private health insurance. So it's a big plus if it's something that you'd like to consider. What else is there? You can also have the option of buying shares for the company. So when you join a medical devices company, I'm not sure if it's the same for all the other companies, but for mine, we have the option to buy shares of the company. So you get a discounted rate for the price of the stocks when trading open. So that's also a big plus in terms of investment. In terms of, I can only think of one, and it's that you don't have fixed hours for the job. Your working hours basically depend on the number of operations that you have to do during the day. It may be that you will be working in 3 different hospitals in one day, sometimes just in one, and then be in a 12-hour, 16-hour operation. So it can be a bit taxing as well. You don't get paid any extra for the extra hours that you do, but it sort of balances itself out, if you know what I mean. Because there are days that you only have one case and that would take 2 hours and that's it for the day. And there are days when it's really busy that you'll have 3 or 4 operations in different hospitals, and it can be a bit tiring. But at the same time, I think of it as well as a benefit, because it's a big learning experience for us, because we get to see different procedures and you get to work through different complications of the surgery. So it's worth it in the end. It depends on the company that you work for. There are companies that, depending on your experience, especially, if you come in, say, as a very experienced scrub nurse, they will match your salary plus more. So it can depend on what your experience is, what your background is, what role you're coming into as well. So if you're going to apply for a sales role, you will be offered more. In terms of the range, I would say it's definitely higher than a band 6. And it would range from a band 6 to probably a band 8 plus. Because if you include the bonus, it will be a lot more. Basically, what happens is you work with a salesperson in the company. So he gets some sales targets, and we get a bonus if he hits his sales targets. It may not be as big as what he gets, but you do get a benefit from that as well. My advice for those people that want to apply for this job is just basically to put yourself out there. Do the hard cases, do the multiple revisions, spine cases, or those hip replacements, those difficult knee replacements. Just put yourself out there. Learn the techniques, learn the procedures, because these reps will notice when they're inside theater, and your knowledge as a scrub nurse and your experience in the theater workflow will be an absolute benefit. So network with your reps, the local reps that work in your hospital, get to know them well, ask them what opportunities there are in the company, because you never know, you might get the job while you're working at it. So just go for it.
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the goes bad.